A warm welcome to this week's presentation of News in Depth, your weekly news documentary program, and I'm your host, Pennifa Nyirenda. Now, family planning is the most cost-effective way of reducing infant, maternal and child mortality. Family planning can also reduce maternal mortality by reducing the number of pregnancies and abortions, as well as the proportion of births at high risk. We join Ruth Kamwi as she looks at the supply, distribution and administering of family planning commodities. This is in view of the progress that Zambia has made since committing to the FP 2020 initiative in 2012. Stay tuned to this week's program.
Kalulushi is one of the 10 districts of the Copperbelt province. It has a unique setting of both rural and urban population. The Central Statistical Office indicates that in 2017, Kalulushi district had a population of 130,707 people. 3/4 of this population are urban dwellers and 50% of the total population are women. As one of the districts, Kalulushi fits into the Demographic Health Survey for 2013 to 2014, which indicate that Copperbelt Province has the highest percentage of married women currently using any modern method of contraception at 50.8%. The unmet need for family planning on the Copperbelt stands at 20.1%. However, information from the Ministry of Health indicates that Kalulushi district has had the lowest uptake of contraceptives on the Copperbelt. To increase the uptake in the district, the Ministry of Health, in partnership with Society for Family Health, a non-governmental organization implementing the Sexual and Reproductive Health for All initiative, decided to pilot a new contraceptive called Sayana Press. Sayana Press was also piloted in Mafinga district in Mochinga province as well as Kawambwa in Rapula province. The pilot of Sayana Press saw a total of 2,100 women captured in the 3 districts using the contraceptive from 2016 to 2017. The piloting exercise of Sayana Press also gave the Ministry of Health an opportunity to assess the efficiency and effectiveness of using community-based distributors, CBDs, who have been engaged to scale up the use of a mix of family planning commodities. The use of community-based distributors in administering contraceptives is in line with the Zambian government's commitment to the Family Planning 2020 initiative. This has been done to improve availability to add to reach communities in all parts of the country by 2020. Dr. Angel Mwiche is the Assistant Director, Reproductive, Maternal, Newborn and Child Health and Nutrition at the Ministry of Health.
We had committed to move contraceptive prevalence rate from 33% to 58%. And of course, if you look at it, it looked ambitious. That was in 2012. When we did the Demographic Health Survey, 2013-2014, we had already made a giant leap because currently we are at 45%. So I think in terms of making progress towards reaching 50%, we are making very good progress. And in general, the other commitments that we made have also helped. Engaging religious and traditional leaders, that we've done very well, and to some extent it has helped a lot.
Accessing family planning commodities and other health-related services in Kalulushi district is a challenge because of its unique setup. For those in Kameme village, a distance of at least 22 kilometers must be covered to reach the nearest health center, which is Kalulushi Township Clinic. Jen Luemba is 56 years old. Jen is a farmer and mother of 2 girls. She's one of the community-based distributors trained in family planning. She prides in having 824 family planning clients dotted around the village, out of which 106 are on the new Sayana Press contraceptive. For Jen, starting out as a community-based distributor has not been easy.
Kwena na bachipokerera munecho bachipokerere musango wakwe bati distance intamfutweni balenda ukufuma kuno kuyafika ku Kalulushi bale shupi kwa bengi imbi kuti bayima baya ku Kalulushi bafika kuli nshita yapo babwelela ati mukese pabushikuwa kuti nomba olo baisa mfuati fwena batu trainer muri family planning bali chipokerera na makabengi bali chitemwa kwe bati mwatu wangu shako bulendo pantu kuti babomba panshite Sayana aisa wa mtunga.
Jen does not only provide a mix of contraceptives to clients from her home, but also distributes the family planning commodities to other community-based distributors. Here, she shows us how the contraceptives are kept. She also explains why it is important to keep them in this trunk.
Then piu na ya ikwatapo ikala. Then hulu na ya ikwatapo ikala. Ama kondom nayo ya ikwatapo ikala. Then na depo subcuts nayo ya ikwatapo ikala. Ero kwadiba ukwakanya uyu wa ubikira hapa uyu mtu wa usungira hapa. Ero ufire wamo na nyinche ndenshi ufire wabera pomuti. Kulingana na temperature panta ufire wabafye kulabika fyene awawe. So ufire wasungira ko pali room temperature.
About 10 kilometers from Jen's home is the dwelling place for Mr. and Mrs. Mutambo. They are small-scale farmers in the area who grow maize and groundnuts for both consumption and selling. The couple has been married for 7 years now and have 2 children and are also keeping 2 dependents. Mr. and Mrs. Mutambo are only planning to have their 3rd child in the next 2 years. This is because spacing their children has made life manageable.
Ini kade yale nanikani ashipa limbi kairinga wakonkanya limbi paisa kwa kwata problem tetu usolve problem nga kumaisha 5 years kuti nakwata sino.
On the flip side is 21-year-old Leah Nakawala. Leah has 2 children but has never been on any form of family planning. She says raising her 2 children has not been easy, but not all hope is lost. Kamema village is not the only one benefiting from the services of the community-based distributors in Kalulushi. Mindolo Health Center, situated just about 10 kilometers from Kalulushi town center, is the meeting place for CBDs from Kabombo village, which is a further 24 kilometers from the health center. And here, Esther Mwila and Dorothy Mibobko have been working with the community since 2015. They say working with the community has given them a sense of satisfaction because more women are appreciating the benefits of spacing children using various family planning methods.
Bashtata bale kwata ukukumanisha okudisha abana efya kulya panganda efu bashale kumanisha kale nama bana mai wabengi bale efwa mulandu wabu fyashi bwino okufyala tapu bale efwa nombapa ni mwana po bukankalo fuma kwa bati bana na bale tushako na bana bale maneka ko bwino tabalelo la nutrition ngefo chade bakale omwana baika tobulele bwansala nutrition utubala no ikala bule fyakulya bale abana bale kwanisha bwino okudisha na yo sibe abafyashi bale maneka kano omubiri bwino kwe bati kwena omufyashi no mwaome na yena
bengi abasekeramu abalanda chichichire chimwaleta chali wamisha sana nachi tulengesha tifwe bantu tusangalale ero kabiri fwe bantu tusambirishe n'abana fwe bantu turekwata kono byantanshi pamayanda abengi bale filo kutwala abana ku masukulu mulandu nafyalo tubano twingi sana ale filo ko batsate benefit ko batatwala abana ku school.
Alice Kampamba is 39 years old and has 7 children. Our oldest child is 21 years, while our youngest is 2 years old. Alice attests that using contraceptives has given her the freedom to work without worrying of having an unwanted pregnancy.
Family planning yesuma mulebo mpya akamwana kali anishikate shani katantalirako wamwine ngorefu okuleka family planning kuchiwalekoro waimita ngorefu okutwalira pa kuchiwatwalire.
Charity Sambambi, who is a mother of 3, says using Sayana Press has not given her any complications. Kalulushi Acting District Health Director Antoinette Ntuba is happy that the district has recorded an improvement in the uptake of different types of contraceptives in the last 2 years.
Where we're doing more at the clinic, is the work is being done now in the community where the CBDs have taken up, and then they are reducing also the overload of the work at the health facilities. And then the nurses there, they are able to also do other activities like educating more the women on the family planning and concentrating on the sensitization, and then provide at the same time the family planning at the health centers, together with the CBDs in the communities, which has helped even from reducing the distance for those who are coming from very far. They are able to access the family planning just from the community level.
Notwithstanding, Zambia is committed to improving sustainable access to family planning and achieving the goals set out in 2012. Among them, to increase the modern contraceptive prevalence rate among married women to 58% by 2020. Government has also realized that for the commitments to be made more sustainable, domestic financing should be increased. In this vein, government wants to ensure that by 2020, its contribution to family planning commodities will increase by at least 50% of the average annual contribution of $1,090,000 United States dollars between 2013 and 2016 to a minimum of $1,500,000 United States dollars per year.
We've made a giant leap there because previously we were entirely depending on contribution from cooperating partners, but funding from central government has increased, and with more lobbying we are likely to increase even more from where we are.
Are we getting that funding, or it's just on paper?
It's not on paper. What I'm talking about is the money that we get. Of course, when you look at this funding, there is what goes into the yellow book, and there is actual money that you get. So when we talk about increasing, we are talking about the money that we actually get. And when you talk about FP 2020, it's quite aggressive. We do these reviews every often, and that's how we are able to know that the cooperating partners contributed this much in this period, and the contribution from government was this much.
The Churches Health Association of Zambia, CHAZ, is happy with government's commitment to ensuring that the budget line for family planning commodities is reflected in the Yellow Book and continues to grow. Yoram Siame is the association's head, Advocacy, Planning and Development.
Actually, we have moved from 2012, from a time where we didn't have a dedicated budget line for family planning. In short, you pick up the national budget and you would be at pains to look through the entire budget and find a very specific budget line saying family planning. We've moved from that not being the case to now where when you pick up the Yellow Book, you can actually find a budget line which says family planning, and you can track its growth or decline. And in truth, the family planning budget line has continued to grow. That is the good news. The place where we need to do better is that this budget line has to be compared with our total resource envelope, which we have given ourselves. So Zambia was among the first countries to do a costed family planning strategy. In short, we told ourselves in 2020, we intend to be at this place with regards to family planning. And these are the sort of investments which are needed to give us that picture. So every time we're talking about a figure on family planning, we need to compare it to our costed plan. So our costed plan takes into account everything from commodities, demand creation, services, policies, you name it, capacity building. We have taken into consideration all the necessary facets. And when you compare what investments are needed, it is quite clear that we fall far below the required investments.
And Family Planning 2020 Managing Director Martin Smith is happy with the strides Zambia has made so far. He is of the view that more needs to be done to increase domestic funding for family planning commodities.
And this is part of an ambitious set of commitments that the government of Zambia set out. The focus on young people and adolescents within Zambia's commitment was particularly impressive. And the desire for a multi-sectoral approach, so not just access to family planning information services, not just being a Ministry of Health issue, but also being a Ministry of Education, a Ministry of Finance, a multi-sectoral approach to services for those young people. The supply chain was again focused upon within the Zambia commitment, and a focus on reaching the last mile and ensuring that supply chain meant that there are well-stocked shelves and accessibility of contraceptive commodities across the broad range of method mix for clients across Zambia. And critically and very importantly, the government of Zambia spoke about the importance of data and data for decision making, so that decision makers at the local level had the information that they needed to make decisions around supply chain, around resourcing, around access for citizens. So the Zambia commitment, not just about money, but ambitious about money and ambition really through several of the critical pieces that we see time and again in neighbouring countries around supply chain, around access for young people and adolescents, around data use.
In the wake of all these achievements, Zambia still needs to ensure that the family planning commodities being consumed are safe and readily available. The Ministry of Health is strengthening the supply chain for family planning commodities through expansion of the Essential Medicines Logistics Improvement Program and other channels. According to the Family Planning 2020 Update Report for 2016, the Essential Medicines Logistics Improvement Program has expanded to 85 of the 106 districts, covering 8 out of 10 provinces. The government is, however, yet to roll out the use of the Electronic Logistics Management Information System.
The procurement unit at the Ministry of Health does the procurement, and once these drugs or contraceptives arrive in the country, the duty of storage sits with medical stores. So they arrive in the country and they are transported to medical stores. Then medical stores' responsibility is entirely storage. The ordering or distribution also sits with medical stores, but is dependent on the requirements of the provinces and facilities. So in terms of ordering, facilities order based on their consumption, and then medical stores delivers to those facilities. So you can see that it's a long chain coming from outside right down to a facility in Shangombo, Kawambwa. So a lot of things may happen efficiently, but sometimes they do not happen efficiently. There may be one lapse or the other. So in that case, you may find that drugs may be available at one level, but not available at the other level. So due to lapses in the supply chain, either at maybe provincial level, district level, or facility level itself, you may find that we report some stockouts when in fact the drugs are available at medical stores. So one strategy is to train the staff in the supply chain management. Yeah. So training them in the supply chain management is just one of the areas that would reduce these lapses.
The Zambian Medicines Regulatory Authority, ZAMRA, is one of the institutions in the supply chain and is charged with the responsibility to monitor all the medicines coming into the country, contraceptives included. Leo Konyambe is the Assistant Director, Marketing Authorization at ZAMRA.
The authority regulates the importation, exportation of these commodities. So by that, what it entails is that the authority monitors what is coming into the country and ensuring that only what has been quality assured. By that I mean the products that have been registered and have been verified to meet the standards of quality, safety and efficacy. Those are the commodities that are allowed in the country. But also the authority goes further to regulate the premises where these commodities are stored and where these commodities are sold. So by that I mean the pharmaceutical wholesalers, the retailers, as well as hospital pharmacies. So, and this is to ensure that all commodities that, especially the contraceptives or reproductive health commodities that are coming into the country, are kept within the suitable environment that would reduce the chances of deterioration, so that the quality of those commodities is maintained.
At the center of storage and distribution of all family planning commodities in Zambia is Medical Stores Limited. Medical Stores works with the Ministry of Health and cooperating partners in ensuring that contraceptives do not run out. At the warehouse, stocks of different family planning commodities are available. Here, a list is compiled of what has been sent out, what has been received, what is in stock, and what is yet to be dispatched. And to ensure that no part of the country is left out in terms of dispatch, all the 10 provinces have been given color schemes. For instance, stocks going to Southern Province have a blue sticker on them, and the destination is also included. Director for Logistics, Ilitongo Sondashi, explains the process.
So the pick list, that is a reflection of what the facility has ordered, is sent into the warehouse, and the document is given to a staff called a picker, who then goes to the location that has been instructed to pick the commodity for the facility. And this commodity then is packaged, and it's checked as well by a different person, just to ensure that the correct quantity, batch and expiry has been picked. And then this commodity is then sealed and is taken to the dispatch. So when we pick commodities for a certain route, a route has got facilities under it, those commodities, then the contraceptives and other commodities which have been ordered, are then picked, packed and checked. And security also does their check, and the commodities are loaded into a truck based on the route that we are servicing that day.
Once the contraceptives are dispatched to the respective destinations, the receiving stations will then distribute according to the orders collected from the health posts affiliated to them. For Kalulushi district, the medical depot located at the district health offices stocks all the supplies. The pharmacy technologist at Kalulushi District Health Office knows what they have in stock.
The consumption of Depo-Provera as of now, it has gone down because of Sayana Press. They are using it more than Depo-Provera. The other family planning logistics like Depo-Provera and the microroot, the tablets ones, we order them from medical stores. But for Sayana Press, it comes through Ndola from the Sarai themselves. And then when we receive it here at the district, that's when now we start supplying the facilities supported by Sarai. So we supply them according to their average monthly consumptions. And then at the facilities, the CBDs now, they order the Sayana Press from the facility to their communities.
And about Sayana Press, the contraceptive that is set to transform the use of family planning, considering its acceptance by many women in Kalulushi, Helen proudly takes me through the figures of how much has been dispatched.
7,686. That's what we have issued from March 2017 to 17th May 2018.
Over and above the picture for the supply, distribution, and administering of contraceptives in Zambia looks promising towards attaining the FP 2020 commitments. The 2013-2014 Demographic Health Survey indicate that 44.8% of married women use any method of contraception, while the unmet need for family planning stands at 21.1%. The target is to have 58% women using a mix of modern family planning methods. With more women able to manage their reproductive health through increased uptake of family planning commodities, Zambia is poised to harness the dividends that come with population control. These dividends, among others, include a reduction in maternal, infant, and child mortality.
Here is where we end this week's News in Depth program, where Ruth Kamwe was looking at the supply, distribution and administering of family planning commodities. We do hope that this week's program was informative to you, our esteemed viewers. And next week on the program, we'll be joining Effie Mpande as she looks at a condition known as leukemia. Do make a date with us for that particular program. For now, we do say thank you so much for watching and do stay blessed.